Heat death counts. Don't trust them. The true toll is higher. Summer 2024 is barely 3 weeks old, and it's already been a record-smashing season for heat extremes, with scores of record highs set from the deserts of California, 124 degrees, to the mountains of Maine, 98 degrees, over the past few weeks. And forecasters say still more extreme heat is on the way in upcoming weeks. But it's not just about a number on a thermometer. The USA's ongoing heat wave has also been deadly. At least 30 fatalities across the West this month are suspected to be related to extreme heat, according to state officials and media reports. The death toll will increase as the summer continues, but experts say the numbers won't ever be right. That's in part because heat kills in subtle and complex ways. Extreme heat stresses the human body, which means its true toll can't be measured simply by counting obviously heat-related deaths, such as heat stroke or hot car deaths. Heat may not show up on a death certificate, even if high temperatures played a role in causing a person's death. Extreme heat stresses the human body, which means its true toll can't be measured simply by counting obviously heat-related deaths, such as heat stroke or hot car deaths. Heat may not show up on a death certificate, even if high temperatures played a role in causing a person's death. Reporting weather-related deaths is far from an exact science, and up-to-the-minute reports are gathered from a variety of sources. The National Weather Service tracks deaths conveyed by its weather forecast offices, where information is gathered from local officials and news media reports. The information is timely and publicly available, but not complete. The Centers for Disease Control and Prevention is the official source of cause of death reporting and is based on death certificate data, so its information is more complete, but often delayed by years after the weather event. But even the CDC's data is not precise nor exact, because the process of filling out death certificates isn't standardized across the nation. Even so, the CDC reported heat-related deaths averaged nearly 900 per year for the 5 years between 2016 to 2021, double the 5-year average from 15 years earlier. Meanwhile, initial media reports of heat deaths often look to local authorities as a source, but local governments have different procedures for disclosing deaths, and they aren't consistent in what is considered a heat-related death. Among the more than 3,000 counties completing death certificates in the U.S., there's reason to believe the forms are handled differently in every county, said Ashley Ward, director of the Heat Policy Innovation Hub at Duke University's Nicholas Institute for Energy, Environment, and Sustainability. Death certificates have multiple slots for adding information, with many potential codes available from a standardized set of codes for reporting primary and contributing causes of death. When it's time to complete the form, if heat exposure or other environmental factors contributed to a stroke or heart attack, for example, Ward said information about the patient's activities in the days leading up to their hospitalization or death might only be found deep in the notes from an emergency room doctor.